We're good?
Okay.
Oh, sorry. I'd like to call to order this meeting of the First Five Sacramento Commission for, what is today, Monday, October 7th, 2019. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon.
Here.
Beth Hassett.
Here.
Terrence Jones.
Here.
Olivia Kasseri. Bruce Wagstaff.
Here.
Scott Moak. Donna Snaringer. Steve Wertz. Lee Turner Johnson.
Here.
Kathy Kossick. Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy. Phil Cernan.
Here.
We have a quorum. This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Saturday, October 12th at 2 p.m. and Monday, October 14th at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Great, thank you. Dr. Jones, will you do us the honor of leading us in the pledge?
Sure. Thank you.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, again, I'd like to welcome members of the public that have joined us here this afternoon. And again, let everyone know that you're certainly welcome to address the commission on any item that's on our printed agenda or any item that is not on our agenda. We only ask that you keep your comments to 3 minutes, please. That's there so that everyone has a chance to address this commission should they choose to do so. With that, our first item, please.
I wanted to add one more thing with Commissioner Moak out today. Commissioner Elliott will be voting in his place.
Okay, very good, thank you.
Item number 1 is approval of August 5th, 2019 draft action summary.
Okay, does any member of the commission wish to suggest a change to this? If not, I'd entertain a motion.
Move approval. Second.
Been moved and seconded. All in favor?
Aye.
Aye. Opposed, abstained, motion carries. Thank you. Next item, please.
Recognition of Dr. Terrence Jones.
All right, very good. For this, I'm going to go down to the podium as somewhat customary for occasions like this and ask Dr. Jones to join me. Okay, fellow commissioners, it's my distinct honor this afternoon to present this resolution to one of our esteemed colleagues, Dr. Jones, Terrence Jones, who has served this commission for what, 9 years? Almost 9 years? 8 years? Okay, probably seems like more than that. But it's very important, I think, on occasions like this where we're really honoring someone who has invested themselves, their time and energy into some of our county's most important work, to know that they are greatly appreciated for the investment of all that, and also that we are going to certainly miss their presence, and in this case, their professional expertise in the area of oral health and dental health. I won't repeat all the whereas is in the resolution, but you should all know that we scrutinized very carefully all the various contribution over the years that Dr. Jones has provided this commission, provided the public, including being our utmost champion for fluoridation and other oral health initiatives that this commission has been involved with. So I again want to present this resolution honoring Terrence Jones, DDS, for his dedicated service on the First Five Sacramento Children and Families Commission. And let him say a few words, and then I'd ask my fellow commissioners to join me down here at the podium for a group photo.
Thank you, Julie. Thank you, Aaron. Thank you to all the people of First Five for putting together this thoughtful kind of appreciation of my service over the past years. As dentists, we often struggle to get our patients to see us more than twice a year. Here at First Five, I can only imagine the gnashing of teeth that took place when you saw me as many as 9 times a year. So
Well, this is Patrick's cue to start thinking of some dental jokes here.
okay, wow. Okay. I'm certain that the celebration here today will pale in comparison to the one that will take place when I'm actually really gone. At my first advisory committee, I was impressed with the broad array of talent and knowledge and experience around the table. This was an advisory committee many years ago. As I look around the room today, I see the same talent is still present, still impressive. In fact, the chair of that very first advisory committee was our own Dr. Steve Wirtz. Yeah. So, however, we know that it is less about the individual talent and more about the sum of our individual parts that gets us to a more expansive understanding of what it takes for a child to thrive in our community. I've so enjoyed my time on the commission. My experience was strengthened my conviction that all our investments must have their origins in community input, be thoughtful, data-driven, and results-oriented. I'm so grateful that I have, to all the First Five, and in particular to you, Julie, for allowing me to share my ideas about oral health. I'm fully aware that the investments we have made in fluoridation and dental clinics did not happen because of any one individual, but because First Five listened to the suggestions, led the community discussions and conversations, and was transparent in its decision-making policies and process, and conscientious in seeing it accomplished. I thank all the staff who have contributed to the oral health team, Chris Clinton, Jan Resler, Robin Alonji. I want to recognize Dr. Kasiri for her embrace of the importance of oral health in contributing to the overall health of our children and throughout their lives. I particularly want to thank Deborah Payne for her crucial involvement in all things oral health. Without her expertise, without her drive and her commitment to the details, our goals would have remained dreams and not become the sustainable gifts that First Five has given to the community for generations to come. First Five has been blessed with outstanding leadership from both our executive director, Julie, and our chair, Phil Cerna. Julie's positive attitude, her empathetic listening to a variety of proposals, and her figuring out creative ways to see them accomplished was and will be an indispensable asset for all our future endeavors. Supervisor Cerner has been a constant on this commission. His leadership here, as well as in our county, inspires respect and confidence that we can have both visionary goals and real-time accomplishments. Thank you all for this opportunity to contribute to the important work of this commission. Keep up that good work. The best is yet to come. Thank you.
Thank you for that, Dr. Jones. At this time, I would invite our commissioners, maybe if they want to say any words first, to say it from the dais so we can have it run through our audio system and then come down and join me. So is there anyone that wants to? Yes, Commissioner Elliott.
I thank you so much for everything that you have done. When my children were littler, they're still little, Dr. Jones gave me lots of tips and told me different types of, gave me different resources, and I utilized all of those wipes that you recommended for their teeth. And it was because during nursing, sometimes you worry about their teeth and the sugars. And so you just were so supportive of me. You were supportive of my family, and you're supportive of my babies. And I'm eternally grateful. So just thank you for everything that you've done for this community and our commission, and then selfishly for me. So thank you.
Thank you, Christina.
Yeah.
Appreciate that.
Lee?
Yes, you started to say, think of jokes. This isn't exactly a joke. But when I think of all the little sets of teeth that are going around our county now, that are fortified, that have been examined and have been treated, knowing as I do for many years how really difficult it was and still is to get appropriate dental service, especially for children, of lower income, there are just no words to thank you.
Thank you. Appreciate it.
Dr. Kassiri.
I don't have a joke either, but
It's because Patrick's going to take care of it.
I really enjoyed working with you, and I just wanted to thank you for your steady leadership, especially with McDack, and thinking of where we started off, where everybody was, some of those meetings were really hard to get through, to the point now that you get there and everything is like check, check, check. And also, again, because of your leadership, we were actually able to get the Dental Transformation Initiative, and were successful in applying for that. So, and I also want to appreciate your advocacy for fluoridation. And I'm hoping that wherever your next adventure is, that you won't forget your first love.
Absolutely. Thank you, Doctor. Thank you.
Commissioner Gordon.
I just want to thank you. But by the way, I like all my dentists, and I think you've done a great service for our schools in promoting the inclusion of our schools as a point of service, as a point of contact, as a point of record keeping, and making sure we have data on how our young people are doing. It's slow, but it's progressing. But thank you so much for your advocacy, and I know you're not going anywhere, so we'll see you down the road. Thank you again.
Thank you.
Commissioner Kennedy.
Yeah, so 3 dentists walk into a bar. I want to say that the time that I've served with you on this board, I have learned I have never seen anybody with such singular focus as you, Doctor. And that focus has served thousands and countless children in this community. So I just have to thank you so much, and I know that you're not done contributing to that, and look forward to working with you in the future.
Thank you very much. Thank you.
Dr. Wertz.
Yes, so Dr. Jones, so you and I were on the advisory committee long ago, and I'm going to focus on a different thing. Everyone's sort of acknowledged all the incredible things you've done, but what they haven't acknowledged is that you systematically have been asking good data questions throughout. You held both the evaluation committee and the commission and our staff to high standards in trying to be clear and address the data side of this, of what the impact is. So you have many different things that you've been offering and providing, and I just wanted to highlight that one as well. And it's been a tremendous pleasure to work with you and be a partner with you on this. So thank you.
You're on your own now.
Bruce?
Yeah, thank you. Just to add to what the others have said, thank you for your commitment and your dedication. I remember the fluoride issue going back to when Tony was the executive director, and I was on the commission before, and I think that your input has clearly made a difference to the community. I can tell you that I had the pleasure of working on a First 5 commission in another large county, and we are leaps and bounds ahead of, I won't mention that county, but we are leaps and bounds ahead of them on that issue, and it's largely due to your influence. So thank you very much.
Thank you. Appreciate that. Very kind.
Ms. Hassett.
Yes, we're already missing you on the strategic planning work group, so please come be part of the public there. I've really appreciated your expertise, and I think it's such a good example of when one commissioner brings just such a depth of knowledge about a particular subject and how that really enriches conversations. And also, I love that you had a different take on some things because you were coming at it from a different angle. So we will miss you up here.
Thank you. Thank you.
Mr. Porter.
Definitely, we'll miss you up here. It's been a great pleasure working with you. We have the same first name. And the focus on dental health. On behalf of the children in this county, thank you so much for your focus, and I know you will continue that.
Thank you very much.
I believe our good friend Deborah Payne would like to say a few words.
Yes, Dr. Jones, it's been so nice serving with you. You may be stepping down from the commission, but we'll keep you as chair of the Medi-Cal Dental Advisory Committee. So we'll keep them working. How about that? We have, so many children have really benefited from your dedication and your expertise for fluoridation, for dental clinics, for in the Dental Transformation Initiative and the 3 pilots that we're implementing. We can always come to you for advice, and we so appreciate the time you take. I really do think you are a twin, because there's no way you can have a dental practice and go to all the meetings you go to, but we appreciate. Can I?
Yes, please. Oh, yes. Thank you. Thank you.
Last but not least. So I'd rather be getting a root canal right now than saying goodbye to Dr. Jones on this commission. Could you? As you would have heard in this resolution, which is so long and so many whereases because it was almost impossible to get it to one page because of all that you have brought to our community, is 8 years on the commission and part of the strategic planning work group, the Financial Planning Committee, the chair of McDAC, so much. Truly speaks to your work ethic and your passion for young children. And that's great. It's a lot of work. That's a lot of work. But it doesn't speak to who you are as a person as much. And that's what I'd like to share a few thoughts on. So I've had the pleasure of working with Dr. Jones since 2015 when I joined the commission, and some adjectives that came to mind. He is thoughtful, diplomatic, soft-spoken, yet relentless in his advocacy for oral health. He's also generous, encouraging, funny, and completely genuine. I've gained so much from his leadership on the commission and at McDAC, and as we say in the office, you are 100% an advocate and a gentleman. So thank you for your leadership over the last decade, and when we experienced that magical trifecta to make a lasting difference in kids' oral health. So we had First 5 funds, we had community will, and we had Dr. Jones as a commissioner. And those 3 things really did lead to community water fluoridation, the children's dental clinics, and thousands of kids being served through Smile Keepers and Early Smiles. So thank you. We have a super small little gift for you, a very small token of appreciation, and thank you very much.
That's really great. Thank you. So good. Picture time.
Okay, now we're going to have everyone come down and we'll gather here in the pit and have someone take a photo of the commissioners with Dr. Jones and staff.
Perfect.
Deborah, do you have your phone?
Where's the list? How are you? Good to see you. I'll get yours in that one.
This is probably the best spot.
There's a lot of lighting, though. I guess we'll have to fix that.
Beautiful. There's a little more. Can you get it? Yeah, we'll all be seen.
Okay, you take yours because mine is, oops.
3. All right. 1, 2, 3.
Oh, this way, folks. 1, 2, 3, say smile. Smile keepers. Okay, there we go.
I think we got it.
some way to get a hold of me. Yep.
I was looking for a
Thank you both for taking photos.
Is it too early to recruit?
Too soon.
Too soon, too soon.
Okay, next on our agenda is the public's opportunity to address this commission on any items not on our agenda. I am not in receipt of any speaker slips, nor do I see anyone approaching the podium. So we'll move on to our next item, please.
Executive Director's Report.
Good afternoon, Commissioners. A couple of items for you today from the Executive Director's Report to highlight. We shined a light on 3 specific bills that would represent significant progress in our efforts to expand 3 areas that we're really invested in. That was Help Me Grow, our improving birth outcomes for African American women and infants, and to strengthen Family Resource Center's ability to receive dedicated funds from the state of California. So I have great news on one of these bills, and we're sort of still holding on the other 2. AB 1004, which was a Assemblymember McCarty bill, did get signed by the governor, and that requires children under the age of 3 receive the developmental screenings that they are required eligible for under Medi-Cal. So that's pretty impressive. We all know that early identification of those developmental delays are critical to getting that first step to making sure that the kids can then get connected to services. And this bill will help that happen. Even though developmental screenings are super critical, only 36% of infants and toddlers ages 0 to 3 years old in the Medi-Cal system are actually receiving those in California. So 36%. And that puts California is ranked 43rd in the nation for developmental screenings on kids 0 to 3. So we really hope that this helps with that. And the governor has until October 14th to sign the other bills that you'll see in your packet, which we are certainly hoping that he does and that we know something by Friday, hopefully. Wanted to acknowledge that the Black Child Legacy Campaign won the Merit Award from California State Association of Counties, otherwise known as CSAC. And this is a super big deal. Our BCLC efforts have been recognized nationally by NACO, and now they've been recognized locally in the state of California by CSAC. And of course, First 5 is proud to be a partner in that work, and I have to say thank you again to Chair Cerna for his leadership and his vision on our efforts to reduce African American child death.
Just wanted to add too that I'll be traveling to Miami in 2.5 weeks, I think it is, for the NACO, National Association of Counties, Larger Urban Counties Caucus, where I've been invited to speak on a panel about child welfare, and they expressly wanted to include Sacramento County because of this work.
Wow, good. Wonderful. 2 new resources from First 5 Association that I wanted to share with you that are highlighted in your report. The first is the association has created a sister agency called the Center, the First 5 Center, and the center's goal is to research and then promote policies and practices that will strengthen systems for children ages 0 to 5 in California. And this is really, it's funded by the Pritzker Foundation, and they're really looking at making fixes to Medi-Cal system, things like those developmental screenings and things that we have maybe not yet been pushed through legislation, but they are writing white papers and doing the research behind what should be best practice for systems change in the state, and are trying to sort of push the envelope on making things better for kids from a budget and policy perspective. And they've also just recently launched a new campaign. It's called All Together Now. And this is a campaign and their rallying cry to sort of amplify the need for those policy changes and systems work to be done around for California's children. And this campaign brings advocates together from across the state to ensure that young kids are prioritized. And so they have a website, Right now, they continue to build it, but if you were to visit it, and I think it's in your packet, that website contains fact sheets, graphics, social media posts, things that you can post and repost, that not only First Fives, but all of our partner agencies can do too. It's sort of all in that effort to speak in one voice and to get the message about early childhood out to folks who are making decisions. So we're really happy about their efforts on both of those two issues. And then closer to home, one of the things that I've been working with Chair Cerna and our county council on are some modifications to the Sacramento County Code related to First Five. Sacramento's commissioner, both makeup and term limits. So we're asking to modify the county code so that the superintendent of schools position becomes a permanent position rather than a community position. This sort of came to our attention when Commissioner Gordon was termed out, and we were thinking, wow, it's so important to have that lens. Someone who understands what's happening at the County Office of Ed, but also at the school districts as a permanent voice on the commission. So we're asking the Board of Supervisors to consider making that a permanent position. And then the other thing that we've asked is that currently the code restricts a commissioner and an alternate commissioner to 3 two-year terms. So in every other year, basically, the commissioner has to apply or reapply to maintain their seat on the commission, and it limits the commissioners to 6 years on the commission. And so we're asking that we move that from 3 two-year terms to 2 four-year terms, so that there's less, applications and reapplications, and a longer term overall to 8 years to help us with continuity, especially when we're strategic planning every 3 years. It's a bit disruptive to have commissioners coming and going all. So that is going before the board on October 22nd, and I will report back on that. As far as our local census efforts go, we continue to be the sort of a backbone organization for 0 to 5 census efforts. Last week, I think, we held our 0 to 5 hard to count subcommittee, where we have WIC and Head Start as our strongest partners in the room, just because of the quantity of parents and children going through those two organizations. We've also got our family resource centers and other funded partners, all of us working together on that outreach plan, and sort of just setting up the plan for how we will make sure every kid is counted in Sacramento, and that we've got the right messages and the right swag and the right places at the right time. So that's continuing all the way through July of 2020, but it's off to a really great start. Two other things just to highlight. First Five California's Mobile Express is going to be back in town again. They've got 2 dates in October, October 8th at Colonial Heights Library and October 10th at Natomas Park Elementary, where they'll be reaching out to preschool kids and doing what they do best, which is getting parents and children involved. And finally, just a congratulations to Supervisor Kennedy on his 3rd annual Fun Fair that was held at Southgate on October 5th, and we had our dry erase boards out there and just promoted that event. And I wasn't there, but I heard it was really, really wonderful, so nice.
And thank you for being there. It was great. And we also did quite a few dental screenings too, Dr. Jones.
Excellent, excellent. And Supervisor Kennedy also put our parent survey for strategic planning survey, where we asked the community and parents to tell us what their greatest needs are, into his newsletter this year. So just getting it out there in a really timely way, super helpful. Thank you. And that concludes my executive director's report.
Great. Do any commissioners have any question or comment for Julie? If not, we do have one member of the public who has signed up to speak on this item, Sheila Boxley.
Hi, good morning, Commissioners. I just wanted to highlight that the Governor did indeed sign SB 436.
Yay.
We are very, very excited. My agency was the sponsor, so we're even more excited, but it finally does have family resource centers in code and therefore lays the groundwork for some further work in the budget process and legislation.
Wonderful.
Thank you, Sheila. Okay. Next item, please.
Advisory Committee update.
The committee did not meet this last month, but we are meeting on Friday, so we'll have an update at the next commission meeting.
Okay.
Evaluation Committee update.
Yes, thank you. The Evaluation Committee met on September 16th and had a full quorum. We reviewed the process for the state report that was going forward. We set the timelines for the next stages of reporting for our annual reports. We discussed the strategic plan strategy for that separate subcommittee working, and we also then looked at some of the issues around evaluation data, getting death data in a timely manner, and other data-specific issues. And I think that was the primary activities for the committee.
Thank you.
Financial Planning Committee update.
They didn't meet. Financial Planning Committee meets a week from Thursday. They didn't meet during this period.
Sustainability Committee update.
Okay, that's me. We met on August 20th to review the evaluation results for the sustainability plan that's going to be presented later on. Terry will be opening that for us, and we're excited to have that discussion. Our next meeting is November 19th.
Very good. Thank you.
Approve amendment to revenue agreement with Sacramento County DHA in the amount of $4,688,443 for the CalWorks HVP.
Yeah,
I need to recuse myself.
I was just about to say, I believe we have some recusals.
You jump.
Okay.
And that goes for me too.
Okay, let the record show that Commissioner Wagstaff, Hassett, and Kasiri have recused themselves from item 9.
Okay. Chris Clinton, our planner who oversees the CalWorks program, will be presenting this item.
Good afternoon, Commissioners. Today I'm coming to you with some good news. Currently, First Five has an existing revenue agreement with DHA for $3.1 million.
Can you get that microphone a little closer, please?
You know what? I'm just short. Sorry. Let me roll in here. Okay, so currently First Five has an existing revenue agreement with DHA for $3.1 million. And in May, staff had received authority from the Commission to enter into a revenue agreement with DHA for a 12-month period for $3.2 million. And here's where the good stuff comes in. In July, CDSS awarded funding to DHA in a higher amount than what we had anticipated, to the tune of $5.6 million for the 12-month period. DHA will be going to the Board of Supervisors later this month for approval, but in the meantime, the plan for the $5.6 million, DHA will fund the Nurse Family Partnership for approximately $1 million, and the remaining $4.6 million will go to First Five for oversight of the CalWorks Home Visiting Program. So today, staff is requesting approval to enter into an amended revenue agreement with DHA for the total amount of $4.6 million. Also, staff will amend CAPC's contract under Director's authority to ensure that the service numbers meet the model fidelity of Healthy Families America. Are there any questions I can answer?
Commissioner Porter.
Yeah, I have one question. It says the family served will go from 630 to 405. Can we just clarify why it's going actually
It's a great question, and that is the model fidelity for Healthy Families of America has a prescribed number of home visitors per, a prescribed number of families per home visitor, and that's 15. And we're trying to ensure that we meet that model fidelity because CAPC is working towards accreditation, and HFA is very strict on their parameters, and that's what they require.
Commissioner Wirtz.
Yes, just a clarification. I think this is really exciting and does expand our capacity within the county to provide home visitation kind of services. I think it would be useful to, and I know our evaluation committee has addressed these issues of the integration of these into our home visiting programs that we have now. Can you just say something about how that integration is going, something about the separate committee that's been working on overlapping outcomes and integration?
So we have from the state a prescribed number of indicators that we need to meet. It's a monthly report. Carmen and I have been working on the milestones for this contract. I am happy to send you some follow-up information on the specific indicators that we are measuring.
No, I think I'm familiar with those. I think it was more the higher level that what's exciting is, although there's different constraints around this money from the services we provide through First Five here, I think there's been a real effort, and maybe, Julie, you can just sort of say something about the real effort to try to make sure that these programs are as integrated as possible, given those constraints and given the indicators. It's more of just a statement that I think a lot of good work has gone behind trying to make these programs as integrated as possible.
Sure. So, and you'd think it'd be really easy for all the county departments to work together since we're all one big happy family. But it actually does take quite a bit of coordination on the back end. So both Chris and Eric have been meeting with the DHA side of the house on a regular basis just to get all of our processes in place. And with everybody entering data into Persimmon, into one data management system, we're able to pull out, is it a CalWorks client? Is it a First Five client? And currently we also have Department of Children, Family, and Adult Services contacts going in there as well. So we can say, is it a 0 to 5 client, or is it a 6 to 12 or 15 or 17-year-old client? So that's like the first time ever where we've had one system that can pull it by funder, by service, and by age. And it has been, fits and starts. It has not been a super smooth process, but we are getting closer to it every day. And we even, I think Chris brought in Dr. Cassirier's Nurse Family Partnership at the last meeting, because we're all sort of seeing the same clients, and we want to make sure that if a family is being seen at Nurse Family Partnership, that that's the right referral and the right program for that family, versus a Birth and Beyond Healthy Families America, versus a First Five, which is a different program entirely right now, the NPP, Nurturing Parenting Program. So we have lots of, it can be confusing because there are multiple models and multiple curriculums within those models. One thing that I've been working with First Five California at their October meeting, we expect that they're going to award some funding. They're going to announce the release of awarding for funding to county commissions to coordinate home visiting across the county. So it's something that we've started because of our collaboration with some of the county programs, but we could definitely be doing more with the Head Start. Early Head Start does a home visiting program too. Some of our hospitals have some home visiting programs. So I would love to have like a coordinator who could work on managing all of that stuff to make the whole system better. So we will definitely be applying for those funds, and I hope to come back in as early as the next meeting to let you know how much we might get and what we might do with that.
And just one follow-up, if I can, on that. One of the things we've looked at from trying to learn from our evaluation efforts and so on is that different clients need different services, and that it's difficult at times to do the assessment to ensure that each family gets to the services that are most appropriate to them. And so I'm thinking the working committee is working on that issue as well, and not only with this growth to Head Start and hospitals, but even within Nurse Family Partnership and the Birth and Beyond and the NPP, there's a real need for ensuring that people are assessed and gotten into the appropriate services separate from getting into the appropriate funding source.
Correct. Yes, 100%, and working on that, and it's critical. Yeah.
Thank you. Funding sources don't necessarily follow families, obviously, and your
Should be
job
seamless to the family.
Your job is to make it seamless as if they were integrated funding. So. I think that's what we're looking for. And just one other thing around the indicators. Did you indicate that that these CalWORKs indicators may also be being tracked in part or totally within Persimmon?
We're tracking them in Persimmon, yes.
Yeah. Excellent. All right, thank you.
If I may add to address your question, Dr. Wertz, about how clients are come in, there are 2 different referral forms that are completed based on the client's need and desire to participate in one of the programs. And then the staff look over that and determine if they qualify or not and which program best fits them.
Okay, any other questions for staff? Don't have anyone sign up to speak on this. If there's nothing further, Madam Clerk, can we please have a roll call vote?
First, I just wanted to mention that with Commissioners Hassett and Wagstaff recusal, Commissioner Wertz and Porter will be voting in their place.
Okay, and actually we need a motion and a second before we take a vote.
I'll move the item.
Moved by Commissioner Gordon.
I'll second.
Second by Commissioner Elliott. Roll call vote, please.
Dave Gordon,
Aye.
Terrence Jones,
Aye.
Christina Elliott,
Aye.
Steve Wertz,
Aye.
Terry Porter,
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good. Thank you for all your work on this. It's important work. Thank you. And for item 10, I believe we get Commissioner Hassett back?
Yes, we
And the
can.
other 2 remain recused?
Yes.
Okay. So go ahead and read item 10, please.
Oh, thank you. Approve appropriation adjustment request in the amount of $1,418,613 for the CalWORKs Home Visiting Program.
Thank you. So you had the right arm of the approving that first piece, and then we need this second piece, which I will let Eric Harold handle.
Okay, good afternoon, ladies and gentlemen of the commission. My name is Eric Harold, Chief of Administration, First 5 Sacramento. So you just heard Chris ask for an increase to our revenue agreement with the Department of Human Assistance for our CalWORKs Home Visiting Program. This is simply a corresponding increase to our approved budget. So we're asking for an appropriations adjustment request in the amount of $1,418,613. Both our revenue and expenditures will be increased by this amount, so it's a zero net cost to the commission. And if you see on attachment 1, those are the 2 general ledger accounts that will be changed, and that's the miscellaneous governmental revenue and the other professional services, which is our community-based organization contracts. And that concludes my report. Are there any questions?
Any questions for staff?
I'll move approval.
Okay. Been moved by Commissioner Gordon.
Second.
Second by Commissioner Jones. I don't have anyone signed up to speak on this matter. Can we have a roll call vote, please, Madam Clerk?
And again, with Commissioner Wagstaff out for this item, Commissioner Porter will be voting.
Okay.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Terrence Jones,
Aye.
Terry Porter,
Aye.
Christina Elliott,
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good. Thank you. Next item, please.
Receive update on first 5 for strategic planning process and approval of the strategic planning timeline.
Good afternoon, Commissioners. I'm Carmen Garcia Gomez, overseeing the strategic planning process. Today, I come to you with an update on the first 5 strategic planning process, and also will ask for an approval of the strategic planning timeline. We kicked off our strategic planning process a week and a half ago on September 27th. We have 5 work group members as they were appointed by your commission back in May. And during our first meeting, we focused on orienting our work group members, reviewing the current strategic plan hierarchy, looking over our vision, mission, and strategic principles, as well as discussing the desired data that will be reviewed by the work group. We also talked about the criteria that the work group will put in place to make decisions. Our commission letter says that that the work group confirmed the vision, mission, and strategic principles. However, we decided to review those, and we will come to your commission in January for approval. Attachment 1 is the timeline, which illustrates the highlights of 4 work group meetings, probably 5, with a 5th work group meeting tentatively scheduled for February. As you see, we will have 2 meetings in November where we will focus on data, looking at the trend report, community findings through 2 surveys that we have out right now, our parent survey and our provider survey. We will look at family information form findings, and then our staff will participate and present a landscape impact presentations by priority area to the work group. Our meeting in December, we look to apply the criteria to the strategic hierarchy, identifying the priorities based on the data that we collected and presented to the work group. We will then hope to approve the strategic hierarchy and come to your commission for approval in January. Our consultants will then focus on writing the strategic plan. We will come to the commission in February. We will go to the work group in February with an approval of a draft strategic plan and come to your commission in March for comments and approval of the draft. We will then go to the Board of Supervisors asking for comments and come back for a final approval in May. The process then takes us to approval of the implementation plan in August. We will roll out competitive proposals in September and begin new contracts July 1st of 2021. Wanted to bring your attention to the fact that this strategic plan will be a 3-year plan that will outline the priorities, goals, and results to be funded and implemented during fiscal years 2021 through 2024. According to the approved 10-year financial plan, which is your attachment 2, we anticipate a 25% reduction in program funding, with approximately $14.8 million being allocated annually. The commission will receive the draft strategic plan in March of 2020, as I previously mentioned, which will provide opportunity for public comment, and the document will then be presented to the Board of Supervisors. We will be coming to your commission in November and December with updates so that you hear where we are along in the process. This concludes my report.
Thank you, Carmen. I have a question. You mentioned that there's going to be the rollout of the competitive proposal process in September of 2020. Is there going to be a formal panel or panels that are established for gauging the responses to the RFPs?
For reviewing? Yes. Yes.
And scoring, I suppose.
Yes, reviewing and scoring. So the process is in which our advisory committee actually takes a responsibility in reviewing those RFAs or RFPs that come in, and then we will review and score and bring to your commission probably around February of 2021 for approval.
Okay. Commissioner Wirtz?
Yes, two things, I think. You've just stressed the circumstance that we're in with this being facing the fiscal cliff that we've talked about, that this is going to be a major 25% reduction in the amount of funds we have for supporting our community. And I think one of the things that we are trying to do with this is have, I think it's going to be important, our community outreach, so that we have good grounding in community awareness of why we're cutting back these great programs, because obviously it's going to be a reduction in what's available to the community, and I think a big part of this is going to be ensuring not only that we get good input on what is to be funded and what might not be funded, but a good awareness of how First Five has dealt with and is dealing with these major cuts in allocation. So I think that's one thing that's going to be really important, is not simply asking for community input, but having a good understanding and help them with awareness about where we are with this funding and why there's less funds available. That then leads to what we do about that. And one, we do what you've just laid out here, but the other thing I think we do is we may need to stress our sustainability efforts around reaching others to support some of these. So I think it's going to be important to talk about our partnerships and where other partners, whether they're private or business or community partners who are coming in, or federal and state funds that are coming in to help support the sustainability. I think that's really critical. The other part, I think, like Black Legacy, Child Legacy, the role of community engagement in solving these problems and supporting our families is going to be as critical as well. So hopefully the messaging around that will be a focus of this over this next year and a half or so of planning.
I couldn't agree more. I think the framing of what's coming is important, and those key messages. And I think that the work that we have already done in our sustainability efforts, and certified sustainable in particular, which segues us to the next topic soon, you're going to see that we have already found partners to help us take over some of these things that we have been solely funding. And that is the way of the future, we hope, and building partnerships to do that is just super important.
And I think messaging that is important, that we are doing that, have done and are doing that, I think is going to be critical, to say we remain partners even if we have less funds to support that, and here's examples of how we're doing that, and raise those other people up like we're doing with our incentives for our partners, in order to increase the community engagement and willingness to support children and families. So.
Thank you.
Any other questions or comments?
Please.
Oh, Mr. Wagstaff?
You may have mentioned this when I was walking back in, but could you clarify who's on the work group?
Absolutely. We have 3 commissioners. Beth Hassett chairs the work group. We have Steve Wirtz and Scott Moak. And then we have 2 advisory committee members, Alexandria Page and Katie Andrew.
So are there members of the community on?
They are, the advisory committee members are members of the community.
Okay.
Yes. And our meetings, of course, are public meetings, and we encourage all of our providers, contractors to attend and bring any parents or anybody that is interested in hearing. We will also, if you look at your timeline, attachment 1, I didn't include the date there, so I apologize, but we have community input. So once the work group and the commission approve the strategic plan elements, which include the vision, mission, strategic principles, the financial plan, the strategic plan hierarchy, which is what we really look at to fund our programs, we go out to the community and reach out to groups that may not be familiar with First Five and do a presentation about what those elements are and have an opportunity for a community comment and input.
I was just going to make the suggestion to give some thought to how you do this, but I think it'd be wise along the way here to interact with, without creating any kind of conflict, but to interact with our Department of Children, Families, and Adults on this. They've got a good sense of budgetary events, things that are happening in the field, things like that, that would probably want to be considered when you're laying this out. For example, what's going on with our Title IV waiver and things like that. All of those things I think might feed into what your thoughts are for the next few years.
Great, thank you.
Commissioner Wagstaff, I can also say that at each of the work group meetings, we do typically have a full house of our community partners. DCFAS is at the table as a part of that. And I really do make a concerted effort to get the packet out to all of our partners and the community members to let them know what's happening at each of the work groups and to make sure that they're invited and have a seat at the table.
Thank you.
Yep.
And
Commissioner Wirtz?
Thank you. Just one other thing that's happening with regard to community input is the survey that's currently out. Is it still out?
It is.
Yeah, and I think that's incumbent upon us all to try to make sure that we get as wide of outreach from, I know we're doing a good job of getting it through our provider networks and so on, and I was pleased to hear, maybe you could say something about the breadth of what other networks you're sending that survey out through.
Sure. I don't have the exact list with me, but I know we have reached out to other service providers that are not funded through First Five, like the food bank and other community-based organizations, 501c3s. We also have posted it on, we have paid advertisement through our Facebook, LinkedIn, and Aaron, what other? The survey, what other post? Sorry. We also posted it on Nextdoor, reaching a lot of community members. One of the Nextdoors is over 19,000 people that are on there. So we're doing a lot to reach not just our funded providers and the people that we serve directly, but other people that may or may not be familiar with First Five and have little ones.
I can chime in now. Multitasking right now. It was basically put on every social media outlet that Carmen said, but what was nice is that we were able to capitalize on all our different outlets, including the Sacramento County social media, as well as doing some paid advertising. So we were able to expand our audience beyond just our followers on each of those platforms that Carmen mentioned, Facebook, Twitter, Instagram, and LinkedIn. And thank you to all that forwarded as well and posted it, because that just also expanded the reach, and several community e-blast lists, including Sacramento Food Bank, Promise Zone, Sierra Health, Supervisor Kennedy's. It just really got it out there. So looking for some good feedback.
And while the survey is on SurveyMonkey electronically, we also did drop off some hard copies to our partners, and we will be picking those up tomorrow and Wednesday and doing data entry so that, it's reaching more than just those individuals that have access to the internet.
Anything else? All right. Thank you.
Thank you.
Next item.
We need to vote on this?
Oh, do we have to vote? Are we voting to approve it? Sorry, I don't have my cheat sheet. All right, we have a motion to approve the timeline. Right, it's just the timeline that we're
Just the
approving?
timeline
Just
today,
the
yeah.
timeline.
I motion to approve the timeline.
Second.
All right. The roll call vote?
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Terrence Jones,
Aye.
Olivia Kasiri,
Aye.
Bruce Wagstaff,
Aye.
Christina Elliott.
Aye.
Motion passed.
Kennedy for Cerna, yes.
Yes.
I'm voting for Mr. Cerna.
Patrick Kennedy. The First Five Sacramento Systems Sustainability 2-Year Report presentation.
Great. Very excited to share this with you. And Commissioner Porter is going to start us off.
Okay, it works. Good. Good afternoon, Commissioners. Terry Hardy Porter, Commissioner and member of the Commission Sustainability Committee. We all remember with this image very well of the fiscal cliff. Right? It portrayed the story of First Five's diminishing funds and our need to cut programs as a result. Dealing with the fiscal cliff became our mantra. It was the story of what's to come, an image that meant doom and gloom for our partners. Faced with planning for a funding decrease and understanding that continuing down the fiscal cliff path would mean many of our programs would be unable to continue to serve the number of children receiving vital services, we began to ask different questions. How do we maintain and even build on the positive impacts we are having on children and families in our county in spite of the funding realities? How can we continue to have the same impact on our result area priorities knowing that our funding is decreasing? What if we were to reframe the problem from a fiscal cliff to one of fiscal opportunity? That's what we're here to talk about today and to present you with. This reframing discussion led to the addition of a key result area in our strategic plan, for the first time identified as systems results in addition to direct service results. Reframing the issue, we began to see this image tell a different story, one of the need to build efficiencies across systems, affect policy, and better leverage our funding with new, alternate, and co-funding opportunities. We then created the how with our system sustainability plan. The plan outlined strategies for addressing each new result area, along with overarching strategies that would affect all of our programs. So it was a great segue. Now we have a new picture. We are now in the initial phases of strategic planning. We have the opportunity to continue to reshape the narrative, building a strong, supported, and collaborative future for our programs meeting the needs of children and families, a future where we are advancing sustainability. In this presentation, you will hear how we have made great strides over the past 2 years in sustainability efforts. Many key partnerships and relationships have been built and strengthened. Awareness has increased through new information channels, and $7.5 million, that's right, $7.5 million in new, alternate, and leverage funding were secured for our programs. In addition, the Commission's Certified Sustainable Initiative was a strategic and innovative commitment that has sparked interest across the state. The work that this Commission has done is visionary, and it's not going unnoticed. First Five's partners, First Fives across the state are watching, asking questions, and assessing their capacities to launch similar initiatives. As you receive this presentation, envision a new picture, one about our commitment to sustaining programs, one that supports the innovation and intentional efforts of our partners that our partners are making towards their own sustainability, one that delivers a positive outlook for our children as a result.
Terry, before you leave the podium, the bar that shows leverage funding, which I know what that means, but do we have any gauge of actuals to what's estimated?
Yes. A good chunk of that is our CalWorks home visiting dollars. Part of that is partnership with the Black Infant Health Program, Dr. Kasiri's shop. Part of that is our dental plans taking over what was the Smile Keepers program and fully funding that by the end of next year. So these are dollars that include real money that we've brought into the county to offset what First Five was funding.
This does not include any, I don't know how to qualify it, but any resources, funding that come from our kind of mini campaign of reaching out to the business community locally to find what have been to date arguably some absent partnerships that might materialize in the form of leverage funding?
Of money. So not included in this, but definitely hoping to have some money at some point to put toward that. I don't think that we even included the sponsorships that we received. So we did do sponsorships for the first time ever this year. And I don't know if those are included because we were looking at money that would come through to fund direct services. And so that was really where we wanted to show real dollars coming in to fund services, but it's something we could, consider putting in the future.
Commissioner Elliott?
Sorry, to your point though, one of the things that we've noticed on the Sustainability Committee is the relationships with the businesses in our community are developing. And while those dollars haven't really come in, aren't tangible yet, it's those like the first step is the sponsorships and the building of that foundation. And I think it's looking really good that they are going to find what their niche is and what they're passionate about in the current services that we provide. So I think that it's definitely heading that direction.
Exactly.
It's just a little slower, probably.
Yes.
Thank you.
Latina?
I'd like to add that on this chart, when you see fiscal year 2021 and the purple line going up, we did include the resources that our partners included in their sustainability plans for leveraging dollars, seeking new grants, and alternative funding. So you'll see that slight increases, including those efforts, and also the efforts that you mentioned as far as our work in dealing with our non-traditional partners in funding.
Great, thanks. Commissioner Wirtz.
Just one quick comment. Are we then going to be able to capture non-funding resources, like if we convince businesses that it's in their interest to support families and children in their workplace with family-friendly work policies? Will that get monetized in some fashion here, or at least another category for leveraging policy as well as funding, let's say?
Can I put a finer point on it? How about the prospect of cost reduction by way of those partnerships developing? In other words, maybe there's business-to-business in lieu contributions that the business community could offer, whether it be accounting services or other things that we currently pay for that perhaps they don't write a check for necessarily, but perhaps their expertise could be adopted if they're willing to partner with us to keep our costs down.
We can definitely bring that back to the committee to look at. It's probably more of a narrative story than a dollar amount on the chart story, but also just thinking about the new McCarty bill that went through that is going to mandate developmental screening and how that might impact our own Help Me Grow grant. So as policies happen, as new partners come on, as somebody picks up something that we were doing and there's a cost savings, I think there should be a way to tell that story. I just don't know how to quantify it right now. So I think that's something we could talk about.
We do. In the sustainability, the written sustainability plan, we did account for in-kind services and even suggested that organizations look for beneficial relationships such as that, where they could utilize maybe a parent who has their child as a service recipient, maybe an accountant that would like to do services and assign a value to that. That should be in a lot of the written plans as to where organizations are searching out for those types of relationships.
Mm-hmm.
Commissioner Elliott?
I was going to say that, and to a finer point, when some of these policies and legislative proposals become reality, we can look to the fiscal impact analysis that the legislature does, and we could do some analysis and pull some numbers from that too and see how that really translates into Sacramento County. So I think there are a few ways we can do that, and that's kind of exciting to think about, to quantify those policies. So yeah, we can talk more about how we do that.
Exactly, and it speaks to the future. I mean, it's been the first couple of years that we are starting these efforts, and everything that you've mentioned speaks to the future of how we actually capture information and quantify as we move forward.
No words?
Yeah, and following up on that, I think the other thing that will become part of the sustainability messaging and so on is the more difficult return on investment kind of piece of this, that if we could be looking at the cost savings. There's some work, obviously, that's been done, for example, for businesses, if they implement family-friendly policies. There's often savings around both their retaining of people and their absenteeism, as well as what's the other? But anyway, there are actual savings to businesses when they invest more in their workforce through their families. And some of that becomes then a tool for further engagement. If we could literally work with some businesses to look at that and saying, okay, so now after you've done that, let's monitor your retention, your absenteeism, and even productivity kind of thing. So just that begins to get a little more difficult to do. But if we're going to do this as a long-term investment, it's probably worthwhile in looking at how to message to business in a way that speaks to their own, their own bottom line, let's say.
Exactly. That's how you get them invested in what's the larger picture, the larger community is investing in themselves. They find it important.
Thank you.
Hello, everyone. I'm Stacy Schwartz Olagundoye with Applied Survey Research, and we've had the honor of being contracted with First 5 Sacramento to produce the 2-year Systems Sustainability Report. I'll now walk you through our systems achievements over the last 2 years as we celebrate our sustainability successes. So at the heart of our systems change work is our goal: to sustain children's health, development, and family empowerment outcomes in the systems that promote them. Now, the Sustainability Evaluation Report is broken down into 3 target areas, and those highlights and accomplishments are broken down by further result areas. So as I walk you through this presentation, we'll be looking at these 3 yellow buckets of public awareness and action, policy change, and financial resources. So there were notable systems achievements that spanned across multiple result areas, and we noted these as overarching strategies. For public awareness and action, First 5 Sacramento created a process for strengthening overall relationships with the business community, as we were just discussing. And that was attracted through First 5 events. Most notably, one of the accomplishments that occurred was the first time attraction of sponsors. And I have the numbers here with me. For the first time ever, $3,500 was raised in sponsorships, as well as an additional $4,500 for in-kind donations. And these 2 buckets of donations were specific to the Creating a Sustainable Future for Nonprofits event. So that was a major success that we hope to replicate over the years to come. In terms of policy change, First 5 Sacramento had a very notable achievement. As you all are aware, in 2017, the Commission created First 5 Sacramento's policy priorities, which was the first time that there was a set level of policy priorities to identify and advocate for and support the policies that affect families and children ages 0 to 5. So having set forth the policy priorities, First 5 Sacramento was then able to track and monitor subsequent bills that went forth and advocate and offer their support on behalf of those bills. The most exciting, I think a lot of us are excited to dive together into the successes of the Certified Sustainable Initiative. Now, this initiative was a responsible and pioneering response to ensure that the partner agencies are best prepared for the changing financial future to come, which Commissioner Porter outlined for us so nicely. The participants of the Certified Sustainable Initiative benefited in numerous ways from the program. 24 funded partner agencies created sustainability plans through the Certified Sustainable Initiative. And an overwhelming $8 million through these partner agencies produced combined leverage funds, as we discussed, and an additional $1 million in operational efficiencies and resulting cost savings were also achieved by doing business sustainably and looking at a more sustainable approach. Some of the exciting highlights of the initiative, according to the participants, are the next slide to come. So, participants received training and coaching on what was deemed the 6 domains of sustainability. And these 6 domains included revenue structure, operational framework, engagement of partners, board, and volunteers, the nonprofit brand, measuring impact and accessibility, and culture, decision-making, and change management, or leadership development. So out of the participating cohort, nearly half of the cohort's plans prioritized revenue structure as a priority focus to sustain funding. Other partner agencies prioritized their opportunities for improved sustainability over the next 3 years. Some of the more notable benefits that participants gained from participating in the initiative were that approximately 2/3 of respondents were satisfied or very satisfied that both the program content and the domain-specific trainings helped to prepare them for their overall work. And what was also extremely exciting was that roughly 2/3 of the participants were satisfied or very satisfied with the technical assistance and coaching that was offered as a benefit to participating in the initiative. Now, bear with me, as a data nerd, I wanted to share one more point because I think this is a time to, celebrate our successes together. But in terms of confidence levels, the cohort together acquired stronger confidence levels around a particular skill set, several skill sets, and those most notably were networking and soliciting grant makers in the business community and developing a marketing and external communications plan. What was interesting, I found, was that in terms of networking with fundraising and development professionals, there was nearly a 15% increase in confidence levels as a result of participating in the program. So that was very exciting. So I'll now walk you through the system's highlights per result area. Those were the overarching accomplishments, and now we're going to dive in through result areas 1 through 5. So beginning with result area 1, decrease infant death. First 5, Sacramento leveraged $275,000 in California Department of Public Health funding to expand their media campaign, specifically to address the disproportionate rate of African American deaths, infant deaths, in partnership with the Sacramento County Department of Health Service. 2 Pride and Joy community baby showers were hosted, which attracted 326 attendees, all of whom received access and information to promote prenatal care. What's astonishing and certainly worth a round of applause is that outreach efforts in the month of the community baby showers resulted in a 197% increase in traffic to the SAC Healthy Baby website during the events month. So that's a huge accomplishment in terms of outreach and awareness, and that should absolutely be celebrated. Also, we want to thank our local and public officials for attending. Over 20 of them showed up and offered support and participated in the baby showers, and that's certainly appreciated. In terms of policy change, the National Association of Counties honored 2019 awardee Phil Cerna and the Sacramento First 5 Commission for policy resolution promoting efforts to reduce African American infant deaths.
I want to be clear. want to be clear, they recognize Sacramento County, not Phil Cerna.
We appreciate you being the spokesperson along with First 5 Sacramento. But it was noted and it was recognized and used as an example to serve other counties to do this kind of vital and important work. We appreciate everyone's efforts at the table. Also worth noting is that during the last 18-19 fiscal year, 11 regional hospitals purchased and provided over 200 cribs to new parents through the Safe Sleep Baby program, along with home visitation referrals and providing parents with safe sleep baby education. And that's what that actually means is put your baby to sleep on their back, not with a blanket, and promoting the information that every new parent needs in order to feel safe and succeed and thrive as a parent. So much systems work has gone into advocating for expectant mothers and infant health, and we celebrate all of these positive efforts to move the dial on infant death. So moving on to result area 2, increased breastfeeding. In terms of public awareness and action, First 5 Sacramento assessed and advocated for federal and state legislative actions to ensure that services and supplies provided through the Affordable Care Act were accessible to new moms. Additionally, a local breastfeeding survey and focus groups for providers and breastfeeding mothers were conducted to identify barriers in obtaining breastfeeding support services. Nearly 90% of respondents felt that the cost burden most impeded their ability to obtain services, an opinion shared by both mothers and providers. Similarly, 80% of survey respondents, and these were mothers only, stated that their barrier to obtaining access to a breast pump was not knowing how to navigate the insurance, programs, or services, and 67% reported challenges with billing Medi-Cal. On the policy side of things, First 5 Sacramento changed their policy priorities to reflect general gaps in services, specifically to take out restrictive ACA limitations on gaps in services so that it now reflects just general gaps in services. So removing those barriers. First 5 Sacramento also partnered with California WIC on a state budget ask for $7 million statewide to improve the quality of breast pumps available to low-income mothers. As an aside, for what it's worth, as a woman and a twice lactating mother who pumped 8 times a day, I can assure you that the quality of a breast pump matters, and every lactating woman should have access to a hospital-grade pump, for what it's worth. Numerous financial resources strategies were also accomplished in terms of increasing breastfeeding. Programs through the Community Resource Project and Sacramento County WIC are currently exploring reimbursement potential through River City Medical Group as an alternate revenue source, which is very exciting. And we look forward to hopefully seeing some changes in the next fiscal year, cost-saving changes. Moving on to result area 3, decreased dental disease. These are our top strategies in working towards efforts to decrease dental disease. In terms of public awareness and action, First 5 Sacramento partnered and collaborated with the Dental Transformation Initiative and worked together to create a greater web presence with interactive parent education quizzes and also collaborate on a short-term media campaign. In terms of policy change, participants in MDAC, for those who are new to the acronym Medi-Cal Dental Advisory Committee, worked together to collaborate on the development of Sacramento County's oral health strategic plan. And there was a lot of momentum around oral health, which has presented opportunities for leveraged funding to offset First 5 funding to keep programs whole in the future, as we began to mention earlier. Some of these opportunities are successfully having found alternative funding by transitioning Smile Keepers from a county-based program to the Early Smiles Sacramento program, which is a nonprofit with significant savings. This reduced the first 5 contract costs as the program stayed whole, retaining services for all children. So children are now served through the Center for Oral Health, Early Smiles, and what I find incredibly accomplishing that's worth noting is that the children are now captured in Denti-Cal utilization rates through the dental plans for the first time in the program's 20-year history. As a data person, this is significant and this matters because now we can demonstrate we're actually reaching the children who are being served, and that's wonderful and very exciting to have the numbers actually align with the work being done on the ground.
I'm going to interrupt. We have a question from Commissioner Gordon.
Just a question. It seems as though some of these savings or redirections of funding are finding a public government funding source which has been available but has not been tapped in lieu of a different government funding source, thereby saving money from the first source. Is there a way to isolate those across all of these categories? Because there's a big difference in mining a government funding source that's already there, which we weren't accessing, as compared to going to a company or a business and saying, would you replace government funding that we're losing? So it just seems as though that would be something worth isolating.
Yeah, we can easily do that because there are Medi-Cal savings for, like, if we could get those lactation consultant services covered through Medi-Cal or through the WIC department's collaboration with River City Medical Group. That's the pilot that they're operating right now. Those would be another government or agency picking up the cost. And then if you look at what happened with our dental plans, those are private for-profit organizations that have picked up the dental outreach program. So there's a little bit of both, and yeah, we can absolutely kind of chart that out as to what is what.
Thank you.
Thank you. So also worth celebrating is First Five Sacramento's taking advantage of Sacramento's unique situation being a geographic managed care county for Medi-Cal dental clients. We call that GMC. So First Five built a relationship with the county's 3 GMC dental plans and successfully leveraged that partnership to bring in more than $500,000 to mobile dental services at public preschool programs. And that's a huge achievement in terms of accessibility for dental services for our young ones.
Dr. Jones.
I can't let this all go without saying something here. So just in terms of, the public and private contribution, I think that's very important. But the DTI funding, the Dental Transformation Initiative funding, was new money that was brought about through state resources about the need for investing in dental services and dental action. And our county got one of the largest grants, primarily, I think, because we were very much involved in putting the resources into that plan. And we received $11 million in funding that would contribute to a medical dental collaboration, so you can expand that kind of contacts with private Kaiser, and so now we have a relationship with Kaiser and with Molina Healthcare, which then has ramifications for our ongoing sustainable plans with regard to that, but also doing a virtual dental home in the schools, as well as doing, like with the Sacramento District Dental Society, community outreach. So it has a wealth of benefit that then goes into public as well as private type of web interactions.
We love seeing that ripple effect. Keep it coming. Okay. Moving on to the next result area 4, increase utilization of medical homes. So this is one of 2 result areas that were identified in the strategic plan as solely a systems change result. The other is accessibility to affordable quality childcare, which follows on the next slide. So if you think back to the strategic plan hierarchy in the multicolored boxes, Result Area 4 and Result Area 5 were both green and identified just as system sustainability efforts. If you're like me, the color coding helps. So in terms of public awareness and action, First 5 Sacramento met with 3 GMCs and 1 hospital system to share targeted messaging on the needs of families and the importance of well child visits, and asked for their collaboration in adopting these policies. Regarding policy change, First 5 Sacramento advocated for maternal mental health policy efforts and co-created a maternal mental health report of recommendations. First 5 Sacramento also supported bills at the state level in support of First 5's policy agenda, and some of these issues included developmental screenings and treatment, early and periodic behavioral health diagnosis and treatment services, and increased access to WIC programs for families on Medi-Cal. Moving on to our last result area, Result Area 5, increase accessibility to affordable quality childcare. This was also solely supported as a systems change result. In terms of policy change, First 5 Sacramento tracked and supported several priority bills that aligned with First 5 Sacramento's policy priorities. Some of those supported bills included a daycare center from birth to first grade licensing options, child care, reimbursement rates, startup costs, and grants, a Child Care and Development Services Act, and a Child Care and Development Services online portal. First 5 Sacramento also participated in the City of Sacramento's Child Care hearing, which convened local government and business leaders, including our esteemed Julie Galello and Commissioner Sneeringer, as well as Chair Cerna. And Chair Cerna, I believe, also gave opening remarks at that event, highlighting First 5 Sacramento's ongoing investment in improving access to quality childcare. Very notable and worth mentioning was the Blue Ribbon Commission report, which highlighted First 5 as a key partner and advocate on childcare. In terms of financial resource strategies, this is again along the trend of looking sustainably at cost savings, but First 5 Sacramento developed a successful strategy to reduce preschool spending by partnering with Head Start and school districts. And approximately $3 million in First 5 funding was saved by transitioning preschool spaces to California state preschool programs and Head Start spaces.
Stacy, can I interrupt to say one thing? 2 things really. That hearing at the city council really resulted in the city of Sacramento allocating money in their budget this year to hire a child care coordinator, a position that they have not had for 20 years, who is going to develop a strategic plan in collaboration with First 5, with SCOE, with so many partners around the table, to create a plan that person will be charged with implementing over the next 5 years. It's a huge, huge thing. So really cool that we were part of that. And then the Blue Ribbon Commission was a state Blue Ribbon Commission with many leaders, and was the very first time ever that First 5 was actually called out, which is shocking when you think about it, like how long we've been here for 20 years and we've never really been called out in a specific way as a partnership in any of the iterations of the Blue Ribbon Commissions that have been around for childcare and early learning. And finally, just being recognized as a legitimate, influential partner at the table, big deal.
Can I add to that in terms of the city's initiatives on childcare? I do have to publicly give a lot of thanks to Vice Mayor Eric Guerra, who's been the City Council's leader on this subject. As I know, Julia knows that hearing that the City Council held on the subject and its ultimate investment of resources on the subject is really a product of the leadership that Eric Guerra has shown on this.
Yeah.
Thank you. So across these 5 result areas, and including the overarching strategies, First 5 Sacramento achieved notable achievements, successes, and really pioneering strategies working towards sustainability efforts, and that should be celebrated and applauded. But our work doesn't end here. Applied Survey Research is very excited to continue working on the strategic plan together with you. We're knee-deep in indicator result data for the trend report. We look forward to meeting again with the planning team in November. But we also want to continue talking about how to move our sustainability efforts forward. And I now invite Mark Simon to come up and share comments with the Commission on looking at next steps and recommendations.
Great. Thank you.
Hi, Commissioners. I'm Mark Simon from Storywalkers Consulting. It's an honor to be here in front of you. My remarks will actually be pretty brief, but I want to start by just saying that it's actually a bittersweet opportunity to be standing up here. And the reason why I say that is because I've been consulting with nonprofits for 15 years now. I love what I do. I love the fact that I get to do a variety of changing projects over time. And for the last almost 2 years, this has been quite a remarkable ride that I'm grateful for having had the chance to help create and to guide. And essentially, my next few minutes, that's it for me until something else comes up. Although I will mention that there's agencies who participated in this initiative that I now am working with to continue to work on an individual basis, which is very satisfying. So it's never done. But it has been incredibly satisfying. And what I want to say, it was very interesting in the early part of this discussion, listening to the amount of interest in quantifying and even just dissecting the financial details of the leveraging. And I think that it's crucial that your commission continues to do that. What I want to say is that my areas of expertise really tap into the heart of this work. The financial details are critical, but it's about how do you communicate with folks where their passions lie in a way that you can translate that into action. And I would say that that mindset is what launched this crazy statewide initiative 20 years ago. It was bold and it was audacious. And what we gradually came to learn, should have been obvious when we started, with Certified Sustainable, was that we were asking each of these 24 agencies to be innovative and to take some risk and to be creative. It wasn't so much of a surprise to realize that. It was more of a surprise to realize, oh, we're actually asking that of First 5 Sacramento itself. So I want to say that there is a report that was finalized this summer that I think did not make it into your materials, but will be coming. It looks like this on the cover, which tells you about nothing except that you know that it's there. I will say that there's essentially 3 parts to it. There is a, 6-page summary of what we did in the initiative. There's a couple pages of recommendations that I'll be speaking to, and then there is a half-page per plan summary of what folks ended up doing. I'll tell you that the plans ended up being on an average about 18 pages each, times 20-something plans. That was a lot. So we've taken all those pages, condensed each one into a half paragraph, and then if you want more, you can talk to Julie and company, and you can see the full deal. So in this report that you'll be getting, there's a page that sums up recommendations and next steps for funded agencies and recommendations and next steps for you all. I'm not really going to talk about the funded agencies. What that boils down to is that the staff need to be in regular communication with your contracted partners so that they continue to work the plan. That's really what the recommendations come down to. The recommendations for you all are posted up here. There's more details in the document that you can read through, but I just want to speak to these very quickly, and then we'll see if there's any further discussion. So the first thing says that you all need to familiarize yourselves with what your agency said they would go out and do, and this report is going to be a critical step for you to get a sense of what that is. The second one is, just because our agencies did what we asked them to do in creating their plans, it's now on us to monitor what happens, and I think that reflects directly on what you all were saying. In fact, monitoring them in ways that we hadn't even thought about yet. What I just heard Commissioner Gordon talking about is even saying which of these are pulling from different but also public dollars, and how are non-public dollars coming in. So there's all different ways to analyze. You saw from the report that there was a high level of satisfaction with coaching, training, technical assistance that folks received for the last year. First five should maintain that position of identifying which capacity building is needed and make that available. And then the last two are, you're very familiar with these, and they are about this agency becoming increasingly externally focused. So make sure to continue to rally the business community so that we go from single thousands to tens and ideally hundreds of thousands of dollars. I also got to work with Aaron, Maury, and other folks on some recent pieces for the Business Journal that were specifically facing the business community. And lastly, that becoming advocates even more than we've ever been to state and local officials, and joining with our contracted partners to advocate with these agencies. And so that is it. I will say that I think every person that says we should celebrate what was done here, I can absolutely only underscore that sentiment. So thank you. And any questions while I'm up here?
I don't think so.
All right.
Oh, what? Yep. I spoke too soon. Commissioner Elliott.
Well, thank you for all of your work on this and in supporting the Sustainability Committee. One of the things that I was thinking through, oh, I don't know where Terry is. We couldn't have done this without the support of the commission, without the support, right in the beginning when we were all kind of unsure of what this was going to look like. It's really incredible to see all of these tangible results, and I think a lot of us were nervous if we would be able to do that, and we couldn't have done that without good business partners like yourself and ASR, and then again the commission and staff, really visionary staff truly around the work that's been done, and then we were just supporting it and adding to it. So all of the work that staff did, I'm really excited to see where this goes into the future. I think your recommendations are right in line with what exactly we need to do, and I think that this is really foundational. So we really appreciate all of this, and so thanks to staff also. You guys made this happen. So.
Great.
Thank you. And actually, I specifically did not want to take any time speaking to what happened up till now. And I'm realizing in not talking about that process, I'm not acknowledging the fact that we were wise and creative enough early on to reach out to Impact Foundry and Kim Tucker. So I want to I want to acknowledge Kim, who's also here. And I just want to also say, because it should be said, that doing this project with Julie and Latina was delightful, and that you guys are in great hands to have them working on so much of what happens here. So thank you.
Great, thank you.
Good afternoon, Commissioners. I'm just here to wrap up our presentation and talk about some next steps that we're going to undertake as we continue to implement our sustainability plan and also build on the great work of our Certified Sustainable Initiative. So we have learned a lot over the past couple of years working on this project, and we will continue to learn as we move forward. Having this evaluation report done gave us an opportunity to step back and really look at all of the things we were able to accomplish. And I think it's safe to say that we feel like we're on the right track, and we want to keep doing more of that. So I'll start, So We did a great job, as you heard, in leveraging our existing funding programs to do outreach and to further our sustainability efforts. But you have seen on our fiscal outlook chart that we're tracking our leveraged dollars, and we're including our co-funded projects and dollars saved as a result of our alternative and new funding. And so we definitely heard the recommendations today on ways that we can further evaluate those funds based on public and private dollars, and also highlighting our relationships that we're building with our business community. By way of technical assistance, we do aim to support our contractors in implementing their own sustainability plans. We are having discussions as staff on how to best do this moving forward, and also taking Mark's recommendations under consideration. One thing that we're doing recently is that we added certified sustainable update as a standing agenda item to our quarterly contractors meeting. We're inviting one of our funded partners to come and speak to everyone about their sustainability plan, highlighting one of the domains that they chose to focus on, talking a little bit about why they chose that domain for their agency, how they're progressing with implementation, and also to speak about some of the challenges and successes that they're having, to be sort of a learning opportunity for others who are in the room. We are also in the process of developing a For Business tab on our website. You'll be happy to hear that. We want to house information and resources geared towards implementing family-friendly policies, as well as the return on investment. We're still in the planning phases, but we do hope to use this platform to build and strengthen our relationships with the business community, and also be seen as a resource to the business community while we're furthering our sustainability agenda. We've had some success in our partnerships that we've developed. We have developed some great relationships by actively networking at various events throughout the county and different meetings. I'm sure many of you have seen myself and Aaron about on many of occasion doing just that, talking about First Five, talking about our priorities, and talking about our fiscal outlook with everyone, and just to get the interest and support. We are very happy that on more than one occasions our elected officials are reaching out to us for information and support on various things. And in addition, I'd like to highlight that our certified sustainable graduates all received certificates of recognition from Assemblymember McCarty and Dr. Senator Pan for their participation in the program. You know that at our 20th anniversary, we received a resolution jointly from our legislators on celebrating that achievement. And as noted earlier, we've had great representation of our elected officials at our community events. So all great things that happen as a work of just networking and being out in the community and speaking to people about that. So lastly, I want to say we will continue to be flexible enough to respond to emerging needs as we further our sustainability plan work, and that we look forward to updating our system sustainability plan to align with our 2020 strategic plan. So we'll be working that through committee in the coming months, I guess in the spring. So that's all I have. I just want to say thank you, and thank you to our contractors, ASR, to Mark Simon and Kim Tucker with their work in Certified Sustainable, and to our Sustainability Committee who just support us and are there to help us along the way. Really appreciate all of the help.
Great.
Thank you.
Thank you. And we have a few comments here. Commissioner Wagstaff.
Thank you. And thanks to everybody who has worked so hard on this. For me, what I'm trying to figure out here is going back to the chart that Commissioner Porter presented at the beginning of this presentation, and the concern we all had about the fiscal situation, which really led to all this work. I mean, I'm trying to figure out the key takeaway here. Would you say, I guess, Julie, this is a question for you, with this work, is the message here that, in your view, our providers, and I realize there's next steps and more work to do, but how would you say they stand vis-a-vis that fiscal cliff then? I mean, can we walk away from this thinking that our providers have strong plans to avoid having to cut off their services?
I think that the reality is that they'll be receiving less funding from First Five, but that through this work and through the creation of their own sustainability plans, they actually have a plan in place for keeping or maintaining the same number of services, the same number of kids, even though the first $5 are decreasing. Some of them got closer to that 100% of kids and families being served, and some of them a little further away. But I feel pretty confident that that is the case. It still is, going to be a challenge to them. There's a lot of things that have to get put in place between now and 2021 when that cut happens. I was just talking with Carmen the other day, and at the next meeting, you're going to hear about the numbers served in the first year of this strategic plan period, where we took a 20% cut, and we saw a 22% decrease in the number of families and children served. So we did not have sustainability plans in place. We had our committee working, but we didn't have anything solid quite yet, and we saw consistent with the cut, we saw that number of families and kids not served. And so that is my hope, is that by doing this work and by really partnering with the contractors and with our community partners and other government agencies and everything, that we will have less First Five money, but that our partnerships, our influence will mean that our impact stays the same as far as the number served. It's a big, lofty, wonderful thing to say. I really do think we're doing the work to get us there, though.
And I'd have one thing to add to that, and it's just in our original sustainability plan that technical assistance for our contractors initially wasn't at the level to do and to act upon. But in our first round of funding and writing the plan, we realized that we needed to provide more support to our contractors, that we do have a reduced level of funding in the future, and how can we best support them. And that's when we pulled in resources and contracted with our consultants to do the Certified Sustainable Initiative to support our contractors through that process. And the goal of that was to have our partners assume, then we were saying a 35% decrease in funding, and to keep the same level of services that they're able to accomplish now, even with that funding decrease, and to be innovative in their work and in their plans, and finding ways to secure public and private dollars to support that.
Julie, I have you in the queue.
I just wanted to, before we wrap it up, give a huge shout out to Latina. She really is the person behind this whole Certified Sustainable Initiative and working on the Sustainability Committee. Just my deepest appreciation for that.
You're welcome.
Commissioner Turner-Johnson.
I just have a couple of comments regarding the presentation. First of all, to thank you, Latina, and our consultants, because I think this is very nicely presented, articulated, it's not confusing, and gives us a lot of really great information. So first of all, that. The other two comments I have regarding the result areas, not to do any more than highlight one, and that being medical homes, only because this is an initiative that I remember when it came about some decades ago, and was coined, that phrase, and understanding that families with the many challenges and sometimes several children, and the issues of public transport to get to appointments, or simply to have the kind of coverage through physical and mental health and dental coverage that all children deserve and should have to be healthy, growing individuals. There isn't one other result area that we have here that doesn't connect to a medical home. Certainly the Black Child Legacy does, certainly breastfeeding does, certainly dental care does. And as a matter of fact, children that come to school without health of all kinds cognitively cannot learn. So, there's no question that I just want to highlight the fact that medical home is central to all of these. The other comment I want to make is just to support Dr. Gordon's comment about separating out funding streams. And the comment that I make about that is that sometimes when we can pull together enough initiative and time supports us, which I'm sure we will face yet again in the future, if federally as well, that there's a thing called entitlement of programs. Medicaid is one, and Medi-Cal and so forth. And there are programs and initiatives that can become entitlements. So having that spelled out so that we can keep that in our minds and the kind of voice that can come behind it of usage by consumers and those of us that are advocates is really important. Thank you. And thanks again to everyone.
Commissioner Gordon.
Just really quickly, I want to say a big thank you to the team, everybody involved in this. It really is good work, because I think so many people still perceive the first five as, well, it's a body that just hands out whatever money is coming in, and you get it and you kind of do some good work. But I think, Julie, you and the team have positioned us as a strategic player in moving this agenda forward, moving this mission forward. The problem is, I'm not sure everybody understands that that's what's happened. So one suggestion I would make is, if all of you could create a really, really high-level summary. I'm talking about a page, like 2 pages at the most, because with all of the work that was done with the sustainability teams, I know, like for the big school districts, it wasn't seen by the superintendents and the board members and all that. So I think if somebody could develop a really high-level summary of how this is supporting the mission long-term, and it's everybody's responsibility to work on it and keep pushing on the sustainability, that would give great support to the staff-level people working on this. So just a suggestion.
Thank you. We will do that.
Commissioner Elliott?
Just really quickly, I really appreciate your comments, Dr. Gordon, because I think that's really important for us to get in those doors with the superintendents and the principals even, and that way they know that it's a priority for their staff and they can then, support that priority. And just to kind of close it out, my hope as a committee member of the Sustainability Committee is that the key takeaway here, again, to your points, Dr. Gordon, is this is a new narrative. This is a new way of looking at this doomsday approach. I mean, I've been on the committee for about 6-7 years now, and it was my biggest angst. And now it's not. I hope that we in the community can embrace this new narrative of partnerships and leveraging our community. And so I hope that's the takeaway, that we are taking strides and making efforts towards this new narrative, towards reframing this, the fiscal cliff. I hope we don't say it anymore, I guess. I think it's just a new way of looking at our financial situation. So that I wanted to add that.
Thank you. Okay, we do have some members of the public that are signed up to speak on this. Been awfully patient. First up, Stacey Shelnut Hendrick. Then after Stacey will be Jeanette Newman-Velez, and then Kim Tucker.
Good afternoon, Commissioners. Thank you for allowing me to speak. I know when many of you talk about agencies, you don't think of the Crocker Art Museum, but you have been funding us, and we have been extremely grateful. We weren't your continuing funders, but we benefited significantly from the funding of First Five. As you can imagine, there's not a lot of museums around the country doing programming for preschoolers, and there's not a lot of funding for museums who do funding programs for preschoolers. But First Five was there for us when we were trying to experiment in this area, and we are truly grateful for their support. When the opportunity to participate in the Certified Sustainable program came, because we weren't getting future funding and they didn't have a carrot to to wave in our faces to require us to do it. They were surprised that we wanted to do it. And we wanted to do it because it was a significant, amazing opportunity. And I wanted to thank the staff and the leadership at First Five and you guys for being so brilliant to support this initiative, because it really allowed us to sort of look out of the work and look forward to the future. Often, we're so engrossed in the activities, we don't have an opportunity to pause, to really regroup, and to think strategically about how we want to move forward. One of the things I wanted to say, because I know you all are interested in trying to quantify and qualify the results of this initiative, and I know that can be difficult, but what I want to say is that sometimes it's really simple. We have a young boy named Eldon who comes to the museum regularly. We do a series of programs. For those of you, some of you have visited, so I know some of you know us well, but for those of you who don't know us as well, we do a suite of programs. Baby Loves Art for 0 to 18, Artful Tot for little toddlers, We Wednesday for 3 to 5-year-olds. You've also funded spaces in the museum that children can come at any time we're open. One is called Totopia. We have Totland, so we have a lot going on. But Eldon comes every week. When he comes to see his teachers, he has a little bit of a speech impediment, and I can relate to that with my New York City accent. But Eldon comes every week, and he's excited to see his teachers. And when he comes, he has been learning language, and he's learning to write. Now his sister Lily comes with him, and his sister Lily follows every move. But what Certified Sustainable did was allowed us not to say goodbye to Eldon. We'll get to see Eldon next year, and we'll get to see him go from program to program to program, because we didn't have to say goodbye. And we didn't have to say goodbye because you and your vision and your smartness and your cool attitude about what you're doing in the community has enabled us to really think about how we want to move forward. Our domain for Certified Sustainable was to really think about our revenue structure for the program and how we can build and tell our narratives better. Working with Mark has allowed us to do that in really simple ways. We realized we weren't talking to our board enough about our programming. We were taking the knowledge and the existence of it for granted. We weren't talking to the community. We weren't thinking about funding in diverse ways. So that has helped. Kim and Impact Foundry, we were able to send the entire staff, not just staff in education, to professional development opportunities. So really, it will have ripple effects for us, and I just wanted to come and share that with you and let you know that we're still there. We invite you all to come and see what you've done, and again, we thank you so much for your wisdom. Thank you.
Thank you. Okay, Jeanette, and then Kim.
Thank you so much, Commissioners. I was enjoying Stacy so much, I forgot I'm next. But just in case you don't know me, my name is Jeanette Newman-Velez, and I'm the Breastfeeding Promotion Coordinator for Community Resource Project, WIC program, and we are very grateful to receive funding to help lactation services in our community. Echoing some of the things that Stacy said, this process has been so critical to supporting us and dealing with the changing funding horizon that we're all experiencing. What it really did is help us hone what our strengths were, but take a realistic look at what our weaknesses were, which is sometimes hard to do, right? But it helped us see, okay, there's a way to overcome those gaps. It helped us to really dig deep and better articulate what our operational framework was and our revenue structure. Those terms in the beginning were like, what do they want us to do? But Mark really helped us, so thank you, Mark, really helped get to the nitty-gritty of what we had to do and help us be more efficient. What was nice is that this process dovetailed with us, with our own agency's strategic plan. So we were actually not duplicating effort, but just making it more effective since we had to do it already. So that was great. The efforts we completed in having to do all this, I think make us stronger, and I think our board saw what we were able to do, and it was very nice talking about the training that we were able to do, the What If conference. We were so lucky because our board was able to go to that, and as a small nonprofit, we would not normally have the funds for that, so we feel very grateful that that was offered to us. And speaking of the Impact Foundry, what I appreciate is Kim's honesty. She would let us know what was good and what needed to change. Coming from the nonprofit world, I didn't see us as a business. I think we didn't see ourselves as a business. We're like, oh, we're a nonprofit. But we have to be just as competitive as businesses, and that's what Kim helped us see. So thank you, and some of the speakers that came to train us. So I appreciate that. I especially enjoyed the branding and marketing training that we had to help us, capture some of that. And there was a saying that one of the presenters, Erica, had said that we need to respect the past but embrace the future. So we've been doing things for a while, a certain way to meet our guidelines, our milestones, but now we have to look at it differently, and this has kind of gently forced us to do that. So I appreciate that. So I just wanted to say thank you again. I want to give one little story, since Stacy gave a story. I want to give one little story. I was visiting a mother the other day. She was homebound. She spoke another language, but she really needed me. And when somebody asked, "You're able to do home visits?" I said, "Yes, First Five makes that possible." This mother couldn't come to us, but if you could have seen the look on her face when she got her baby to latch and her husband was there supporting her, that's what you're all doing. That's what you've made possible. And hopefully in this process, we'll be able to continue that legacy. So thank you again for your foresight in helping us to help families be more resilient. Thank you again.
Great, thank you, Jeanette. Okay, Kim?
Good afternoon.
Good afternoon.
Thank you to the First Five Commission for its focus on sustainability, and to the Board of Supervisors for the value you've placed on children of Sacramento County. It was a pleasure and a great learning opportunity to partner with First Five in their sustainability work with contractors. Our schools, our government agencies, and our local nonprofits have an instrumental role in the health and school readiness of our children. Full ongoing sustainability is defined as attracting and utilizing the right mix of resources to fulfill impactful outcomes in our neighborhoods. We encourage First Five to continue this effort and to include meaningful cultural responsiveness in the work at all levels. Certified Sustainable represents the first time Impact Foundry has worked with a county agency on national best practices of sustainability. We congratulate those pioneers, namely right here, for this work, and we remain a community champion, not only of First Five, but of all of you, and we really do encourage you to keep it going. So thank you. Impact Foundry's job is to help nonprofits realize their dreams. Their job is to change the world. We're here to see that they can. You made it possible for 22 agencies of one form or another, so thank you.
Great, thank you, Kim. Okay, my understanding is we don't have a vote on this. We're just receiving it. So again, thank you to our staff, to our consultants who have been flanking on this for a number of months. And thanks for those that took time out of your busy schedules to express yourself on the subject this afternoon. So with that, we are on to commission member comments. Any comments from commissioners? Commissioner Wirtz.
Just one quick one. Speaking of these broader issues and the developmental lifespan for our children and families, I think it's worthwhile to mention that the City of Sacramento policy around expanding bus services or transportation services for all children, all school-aged children, is worth just acknowledging as being in the mix of systems change and support that we want to acknowledge and continue. So, just to
thank you as a member of the RT board. I appreciate that. Any other comments from commissioners? Again, Dr. Jones, thank you for your service. We're going to miss you. And if there's no further business before this commission, we stand adjourned.
Okay.
Yep.
Okay, thank you.